This is take 4, 5, 6. I don't even know. Let's just do this. Deep breath. You're probably laughing at me right now. Hey YouTube and any other viewers watching. My name is Jen and I am a registered practical nurse in the province of Ontario. And today I'm going to share with you 5 tips for long-term care nursing and basically to make the most out of your time in long-term care. Okay, so let's get into it. 5 tips. My first tip for you is to not take anything personally when it comes to your interactions with your residents or your patients. They would be residents in long-term care. So most of the residents that I have worked with have a diagnosis of dementia, either mild, moderate, or severe. So it was varying degrees, different personalities. You may not always get along with each resident, which can make for some pretty interesting interactions. Everybody comes from a different path of life, walk of life. Over time, you learn that you really can't take anything too personally. Everybody has to be treated the same way. And yeah, so that's my first tip for you. So my second tip for you is to try to build a good relationship with the coworkers on your floor. So this may be especially difficult if you're a new grad coming onto a long-term care unit. It can be very difficult because usually most of the staff have been there for years or are very familiar with the residents, with the facility. So breaking through can be a little bit difficult, but ways to do that is take initiative on your unit, show your staff that you're there to work, you're there to help the residents, and you're there to help them. So always show that you're willing to help them and they will always be willing to help you in return. So my third tip for working in long-term care as an RPN is to always be aware when you're feeling overwhelmed or stressed out. It can be very busy between the type of residents that you work with, the documentation, the medication passes, the treatments, working with families and the physicians. It can be very difficult. So be aware when you're feeling stressed out. The good thing about long-term care is that you have 3 different shift options. You have day shift, evening shift, night shift. Day shifts always tend to be a little bit busier. Feeling burnt out or stressed out from that shift, you could always try and reach out and see if the option to try evenings is available, if it works with your schedule, or even night shifts. If you prefer day shifts but you feel like you're becoming burnt out on your unit, you can always try to switch to a different unit on that same shift. That's a good option. I worked on the same unit for 2 years, and by the end of it, I was feeling a little bit like I was ready for some change. But you can always make a change if you're feeling unhappy. Don't leave yourself feeling miserable because it'll affect your home life, it'll affect your work life. So my 4th tip for you is to utilize all the education that your facility provides to you. So not only are they usually paid days, paid education days or workshops, but it truly does help you work with residents that have different diagnoses, specifically dementia, help pass those skills along to people that may not have been educated in the same way, just to benefit each resident. So definitely utilize the education that your facility will provide to you. Tip number 5, I'm going to finish you off with one more tip. Always advocate for your resident or your patient. I learned this the hard way throughout my 7 years in long-term care. Do not be afraid to report staff if you see something wrong. Do not overlook it. What you can do is try and address it first by yourself if you have an issue with either the way that they're providing care or something that you've seen that they've done. But when it comes to any type of verbal or physical abuse, do not be afraid to report that staff member. I know it can be difficult and uncomfortable, especially if you have like a good working relationship with them and you see them all the time, but we ultimately are there for the residents. We have to always advocate for them. That comes above everything. I had to deal with this more times than I wanted to, and I was a new nurse. This was within the first 3 years of me practicing as a nurse. I had to deal with this, so do not be afraid to report staff if needed. It's part of our duty. So that's all the tips I have for you for today. Long-term care is very difficult, but it can also be very rewarding if you let it. Some of my most memorable moments in my nursing career have come from things that I've experienced in long-term care, residents that I've met, and therapeutic relationships that I've built. Hope you can find joy in long-term care the way that I did. Stay tuned for more nursing videos to come. Happy nursing and have a great day.